Bon dia, and welcome to Move to Portugal Daily, episode 128, 2026-0512. I'm Mateus Costa with the Portuguese Pride Network. In the next 10 minutes, I'll give you exactly what you need on Healthcare Unpacked, SNS, private insurance, and real euro costs for Lisbon, Porto, and the Algarve. Let's run the numbers. Picture this. You arrive with a scratched suitcase, a new apartment key, and on day 3, you twist an ankle. The hospital visit is quick until you open the bill and see a figure you weren't expecting. By the end of this episode, you'll have 3 clear euro ranges to budget for and 3 decision points to choose public SNS care or private cover for Lisbon, Porto, and the Algarve. Here's the promise. I'll give you 3 concrete ranges: private plan costs, emergency or private visit fees, and prescription and dental out-of-pocket numbers, plus a 4-step action plan you can follow on day 1. Those ranges: private plans roughly 30 to 120 euros per month for individuals, 120 to 350 euros for families, and higher retiree plans 150 to 400 euros. ER or urgent private consults typically run 150 to 450 euros. Prescription and dental costs usually sit between 2 and 25 euros for common medicines and 30 to 120 euros for dental visits. Stick with me and you'll be able to budget in euros and move with confidence. First, SNS enrollment and how the public system works. To access SNS as a resident, you'll need 3 basics: a NIF, tax number, proof of address, and your residency card or registration certificate. Step 1. Get the NIF. Local tax office or an intermediary can do this ahead of arrival. Step 2. Register at your local Centro de Saúde. Bring your residency card or proof you've applied for residency, your NIF, and an address. If you're a dependent family member, bring marriage or birth certificates to add dependents. Once registered, you'll have access to primary care and many services at very low cost. What does SNS actually cost? For residents, GP visits are commonly between 0 and 5 euros, with copay exemptions for certain groups. Specialist visits typically 5 to 15 euros. Many preventive services and emergency stabilization in public hospitals are free or very low cost for registered residents, but wait times vary. In Lisbon and Porto, you may wait longer for non-urgent appointments. In the Algarve, smaller centers sometimes have faster GP access, but fewer specialists. Remember, SNS is excellent for basic and emergency care, but it's not always the fastest route for private specialist appointments or elective procedures. Next, private insurance. Who needs it and what it costs? Private carriers like Médis, Multicare, and AdvanceCare dominate the market. Expect individual basic plans roughly 30 to 120 euros per month, depending on age and coverage. Family plans typically run 120 to 350 euros per month. If you're over 60 or want broader coverage, shorter wait times, private hospital rooms, international coverage, budget 150 to 400 euros per month for retiree or high cover plans. Why choose private? Faster specialist access, English-speaking networks in Lisbon and Porto, and predictable billing. Note regional differences. Private plan premiums themselves don't change dramatically by city, but private clinic availability and wait times do. Lisbon has more private specialists in hospitals, the Algarve has fewer options outside Faro or Albufeira, and Porto sits between those two. Now, the real money you'll spend out of pocket if you go private for an urgent consult or ER visit, expect roughly 150 to 450 euros per event, depending on severity and whether imaging or admission is required. A standard dental visit ranges from 30 euros for a cleaning to 120 euros or more for more complex work. Larger procedures cost more. Prescription copays vary. Many common drugs are 2 to 10 euros. Some specialist meds or imported items can be 20 to 25 euros or higher. In Lisbon and Porto, you'll often pay a premium for private clinics, while smaller Algarve towns may be less expensive, but with more limited specialist options. Factor in transport and possible translator costs if you prefer English language care. 4 practical action steps to secure care on arrival. 1. Get your NIF immediately. You can't register without it. 2. Register at the local Centro de Saúde and request your assigned GP. Keep the registration receipt. 3. Get at least 2 private insurance quotes from Médis, Multicare, or AdvanceCare, and compare network hospitals in Lisbon, Porto, and Faro. 4. Check prescription lists for any existing medications you take and confirm coverage or substitution options. Do these 4 steps in your first week and you'll avoid gaps in care. 5 common mistakes I see newcomers make. Assuming tourist care equals resident care. Skipping a translator during complex consultations. Ignoring waiting lists until an issue becomes urgent. Choosing an insurer without checking the local network of hospitals. And underestimating dental costs. Avoid these, and you'll save time, stress, and unexpected euros. Listener question time. How do I cover pre-existing conditions? Short answer. Be realistic and get organized. Most private insurers will either exclude pre-existing conditions for a period, charge higher premiums, or offer a specific rider at extra cost. Expect a surcharge or waiting period. In euro terms, that can add 20 to 150 euros a month, depending on the condition and your age. Immediate actions: disclose conditions honestly on quotes. Ask insurers for written terms on pre-existing coverage and keep detailed medical records and translations. If coverage is limited, rely on SNS for emergencies and use private care selectively while you secure broader cover. Quick, practical tip you can use today to save. When you pay monthly premiums abroad, avoid bank FX markups. Many insurers accept SEPA transfers. Use a low-cost FX service or a euro-denominated account to pay premiums and save 1 to 3% per payment. Also, request written quotes showing exactly what's covered and save receipts to build your moving budget. Before we go, download the one-page healthcare checklist and sample insurer questions at portuguesepride.network/health. It lists the exact documents to bring to the Centro de Saúde and the 5 questions to ask every insurer. Join our weekly expat Q&A there if you want follow-up on individual cases. Recap in 1 minute. Private plans, roughly 30 to 120 individual, 120 to 350 family, 150 to 400 for higher retiree options. Private urgent consults, 150 to 450. Prescriptions and dental, typically 2 to 25 and 30 to 120 respectively. Do the 4 steps: NIF, Centro de Saúde registration, 2 private quotes, prescription checks, and avoid the 5 common mistakes. That's your move today. That's your move for today. If this helped, hit subscribe on YouTube and follow on your favorite podcast app. For more information, visit nomadlifesuccess.com. This is Mateus Costa. Saúde, and I'll see you tomorrow.